Are you going to have your blood pressure checked this year? Yes, are you going to have your blood pressure checked? Or when was the last time you have your blood pressure checked? If you haven't done that, please go and have your blood pressure checked. Anyway, welcome back to my channel. I'm Okoyemi by name. This channel is about sharing of health tips to live a healthy life as well as cooking of food. So if you are new on this channel, I want you to please subscribe and I believe you're going to enjoy the channel. And for the returning subscribers, thank you. I think you should already have a clue of what we're about to discuss today. We'll be talking about high blood pressure, that is hypertension, what you need to know about high blood pressure, the risk factors that causes high blood pressure, as well as symptoms of high blood pressure, and food that can lower high blood pressure, and also lifestyle changes that can help to prevent high blood pressure. So let's get started. What is high blood pressure, which we normally refer to as hypertension? Hypertension is when the force of the blood pushing on the blood vessel walls is too high. It means your heart has to work harder than usual in order to pump blood around the body. And this can put extra strain on the blood vessel and also other organs in the body, and it can lead to medical emergencies such as heart attacks and stroke. The only way to know if your blood pressure is high, normal or low is to have your blood pressure checked. You can't know the status of your blood pressure without having it checked because hypertension is like a silent killer. When by the time the symptoms show up, the damage might have gone too far. Blood pressure is recorded in two numbers, the systolic pressure and also the diastolic pressure. Let me save the grammar. Most times, if you visit the hospital to have your blood pressure checked, you will notice that the result is recorded in two numbers. So the upper number is referred to as the systolic pressure, while the lower number is referred to as diastolic pressure. The normal range of blood pressure ranges from 90/60 mmHg, the mmHg means millimeter in mercury, to 120/80 mmHg. So if your reading is above this, it means you might be at risk of developing high blood pressure if you did not put your blood pressure under control. But the target for those above the age of 80 is usually 150/90 mmHg. Now let's talk about the risk factors that increases high blood pressure. The risk factors that increase the chances of having high blood pressure. One, age. According to research, starting from age 65 and above, there's every probability that high blood pressure might develop. Also, family history. If you have a family history with hypertension, you might likely develop hypertension. Certain chronic conditions such as diabetes and kidney problem can also lead to high blood pressure. Also, obesity or excess weight. This puts pressure on the blood vessels and this can lead to high blood pressure. Lack of exercise. Lack of exercise can lead to weight gain and this can also lead to high blood pressure. Also, smoking and drinking of alcohol can lead to a temporary increase in blood pressure. Eating too much of salt. Eating too much of salt can make the body to retain fluid and this can lead to high blood pressure. And also stress. High level of stress can lead to a temporary increase in blood pressure. And also fear. For some people, the fear to go and have their blood pressure checked might also be a cause of temporary increase in high blood pressure. So therefore, please watch out for all these risk factors. Symptoms of high blood pressure include severe headaches, chest pain, difficulty in breathing, vomiting, nausea, confusion, anxiety, blood visions, nosebleed. Please don't wait to have all these symptoms before you have your blood pressure checked. Always check your blood pressure regularly. Now let's talk about food that can help to lower blood pressure. That could lower blood pressure include green leafy vegetables such as kale, spinach, cabbage, and so on. Any green leafy vegetable you can think of. Also berries such as blueberries, strawberries, and so on. Oats is also very important. Oats also help to lower blood pressure, as well as nuts and seed. Nuts such as almonds, walnuts, and so on. Lifestyle changes that can help prevent high blood pressure. One, be more physically active, which can include running, swimming, walking. You can take a stroll, and also dancing. They can also be of help. And make sure you get at least 150 minutes of moderate exercise in a week. And also, if you are overweight, please work on your weight. And also avoid too much of salt in your diet. And also sit less. If your work has to do with more of sitting, try to stand up at intervals. Also avoid smoking and drinking. You can cut down on your caffeine and also avoid fatty food. If you are not opportune to book an appointment with the doctor to have your blood pressure checked, you can easily check your blood pressure in health center around your community or pharmacies around you. They can do it for you for free or just charge you with a little amount of money. And also, if you can afford to get a digital blood pressure machine at home, that would be nice. But note that an uncontrolled high blood pressure can lead to complications such as eye problem, heart attack, heart failure, strokes, kidney problem, and other chronic health conditions. Please make sure you check your blood pressure. Thank you for listening. I hope you do enjoy this video. If you do, don't forget to share it with others so that they can also benefit from it. And don't forget to also drop your comments. Comments are welcome in the comment section. And make sure you also subscribe if you are new on this channel. So then, see you in my next video. Thank you. Bye.